The warning lights are flashing in England's NHS, a service having to save £22 billion in 5 years, while dealing with chronic staff shortages. Leaked plans reveal that savings means closures.
We found evidence across England of plans to cut, change and in some cases close frontline services, so things like GP surgeries, like A&Es and like hospital beds.
But is it fair to say that a lot of these plans are hypothetical to a certain extent? Therefore, they're doomsday scenarios, aren't they?
This is not a piece of ideological research. This is a really comprehensive audit done by health experts.
The leaked plans suggest that in northwest London a £1 billion shortfall would mean cutting 500 beds. In Leeds, 5 wards would be at risk of closing. And the number of acute hospitals in Leicester would be reduced from 3 to 2.
Leicester is very unusual if you look at a city of that size and still having 3 hospital sites that run. That's not very efficient in terms of workforce and staffing rotas across those sites.
So the sense that these plans are more than just draft ideas, despite the Department of Health insisting nothing is final. At this central London hospital, the savings would be made by closing down the A&E department. And it's the suggestion of cuts to frontline services which only underlines the urgent nature of the political drive to ease the funding crisis in the NHS. Earlier this week, ITV News revealed that 16 trusts in England had been forced to close or suspend essential services because of staffing problems during the last year.
There's a real risk that pressures that the NHS face will get greater, that services could cut, and that patients will find it harder to get an appointment with their GP or to get an appointment at the hospital.
And even if NHS managers hit the target of £22 billion in savings, will it be enough?
At the end of the 5-year period covered by these plans, the NHS will face on a year-by-year basis a new funding gap emerging as the population continues to age and new medical treatments are invented that we have to offer to patients.
Labour and other opponents of the government's NHS policies argue that any funding crisis is caused by political choice.